Yo, this shit OP.
Host. I'm gonna share the screen. Okay. Stop the share. All right, I think we're all set. I had a little bit of issues before starting this. So welcome Jordan, welcome Gian. Can you two speak? I just want to know if we are hearing you loud and clear.
Yeah, I can hear you.
I can hear you. I can hear both of you.
I'm just gonna make sure that on Facebook they hear you. So I'm gonna leave just to listen and come back. You guys can talk.
How's it going today, Jordan?
Good. Groundhog
Yeah,
Day.
yeah, it kind of feels that way.
So welcome Jordan, welcome Gian. Can you two speak? Just want to know if
You doing anything for the long weekend?
Pardon me?
Are you doing anything for the long weekend?
I'm just golfing all weekend.
Oh, that's good. Hopefully it's nice.
Yeah, hoping so.
So it's working right now. Everybody's we can hear us talking, which
Awesome.
is
Let's
very
do it.
excellent. So we're gonna start this podcast this week. We have a special guest. It's Jordan Leeming. Before we start that, just a refresh of if you guys want to join us on Zoom, you can download the application and click on the link. Actually, I'm going to send the link on Facebook. Just give me a second and I'll do that. And you guys can join us right away during the meeting. Now, when you join us, you're just going to wait at the end of the podcast, actually, and we're going to accept people to come join us live and ask your question directly. So there you go. The link is sent on the Facebook page. And if you do have some questions, feel free to send it to us anytime during the podcast, and we will try to answer your questions. All right, with that said, today we do have our physiotherapist, Jan Prosser, with us, and Jordan Leeming, who is the fitness and sports and recreation manager in Wainwright. But he's also a certified clinical exercise physiologist. Before becoming our manager here in Wainwright, Jordan did start his PSP career in Wainwright as my predecessor. So I would like to begin by thanking him to share with us his knowledge and welcome him on this podcast. Let me start with a question to you, Jordan. You had the chance to do some out-can PSP jobs, work in Edmonton and the Yukon territories. That is very interesting work experience. Can you tell us more about that?
Yeah, for sure. First of all, thanks for the invite. It's kind of my first social media experience and definitely my first podcast. So I'll try and make it through as best as I can. So yeah, I started in PSP about 6 years ago in Wainwright, actually as a physical exercise specialist. It was sort of my first real job outside of school. First job working with, definitely working with the military population. Before that, I had no real experience at all. So bit of a shock to the system when I moved out here, but I kind of got my hands on and got some good experience. I moved on to Edmonton after about a year here. When I was in Edmonton, I was the fitness coordinator for a little while. Like you said, I had a few opportunities to deploy with the military. I spent my first deployment was about a month. I spent up in the Whitehorse and Haines Junction up in the Yukon territories with some members of both the Army and the Air Force. Was up there for about a month and doing some fitness stuff up there. And a few months after that, I deployed to Kuwait for 6 months on op impact. I had a good chance to get a firsthand sort of experience of what the military members actually do when they're deployed. I was on an Air Force deployment, so it was a little bit different than some of the Army operations that are going on and things like that. But it gave me a really good understanding of what actually goes on when we talk about our members deploying and preparing them for deployment. So when I came back, I took on the reconditioning manager job in Edmonton. I was in that role for about a year and a half. I brought some of my experience that I gained from those deployments. I'd always thought I knew what a deployment was like and what our military members did when they deployed, but until you're actually over there and get a good idea of what's going on, it's my original thoughts of what went on were totally different than what actually happened. So came back and applied some of those skills to the reconditioning manager position and the department there. And then about a year and a half of that, I'm back here. So, I kind of got a bit of a taste of everything over the last 5 or 6 years within the organization. And I still have a very high appreciation for the reconditioning world and sort of what you guys do and the important role it plays within the entire fitness and sports and recreation department. So, yeah.
Yeah, it is a really good experience. Like all these stuff that there's not a lot of PSP who have the chance to do all this kind of experience. So I would like to say that it's unique and it's kind of really nice that here in Wainwright we do have a person who do have all the experience and can share it with all the people. I know you did also a presentation with the CSEP about that deployment in Kuwait, and it was really, really interesting. I did assist that presentation. It was really interesting to hear about that. You've also mentioned that you became pretty passionate about foot health, ankle mobility, and all. Can you tell us a bit about that?
Yeah. So I mean, when you kind of threw out the request for guests on your podcast, an area that not only to me is fairly important and is sometimes overlooked was foot health and ankle mobility. And a couple years back, I dealt with really some pain in my foot and plantar fascia and that sort of thing. I was dealing with just some pretty bad shin splints and that sort of thing too. I did my research and looked in, and I've made some changes to my lifestyle, and wanted to come on and sort of share my knowledge and my experience and kind of get some other people's opinions. So that's kind of what I'm passionate about right now, and what I kind of do in my personal sort of fitness routine. So I'd love to jump into it. So before getting into the nitty gritty details, any chance, Francis, you want to give us a brief breakdown of the foot anatomy and ankles, so we can kind of explain to the listeners what's sort of happening with with the foot?
Challenge accepted. So to do that, we're going to start by sharing my screen and showing you guys the foot. Perfect. Okay, you guys are not really going to see this, but that's all right. You know who we are. Okay. So, given their numerous bones, ligaments, and articulation, the foot and ankle are arguably the human's body most complex area. You don't believe me? Well, let me tell you something. This structure contains 26 bones, 33 joints, which 20 of them are actively articulated, and more than 100 muscles, tendons, and ligaments. Wow, just by knowing this by memory is a miracle. But all this complex structure helps us to absorb the impacts of our body, gain agility, strength, and mobility. As you can see on the picture, these little round bones are called sesamoid bones. The largest of them is called the calcaneus, and it serves as an attachment for the calcaneal tendon, which transmit the force of the triceps surya muscles in plantar flexing the ankle. Also, the articulation of the calcaneus with the talus form the subtalar joint, which is an articulation essential to proper function of the foot and the ankle complex during the load bearing. The bone of the foot form two primary arches, as you can see at the bottom left. The longitudinal arch and the transverse arch. As you can see on this picture, the longitudinal, that's a hard word to say, arch has a flat surface on the distal side of the foot and an arch on the medial side of the foot. Now, during weight bearing, the arch compressed to absorb and distribute the load. The integrity of the arches and their ability to absorb loads are maintained by the assistance of several ligaments, the tight fitting of articulation between foot bones, and the action of intrinsic foot musculature, and the strength of the plantar ligaments and the plantar fascia. Enough anatomy, but this information will help us to understand the topic of today, which is plantar fasciitis. We will try to explain that injury and give you tips on how to manage the injury before, during, and after it happens. Now, Gian, can you give us some information about the symptoms of the plantar fasciitis, as well as the risk factors and the physio treatments of that?
For sure. Do you mind showing that picture of the cadaver foot for me?
Let me do
So
that.
I'll just get you guys to take a look at the bottom of this cadaver foot. You can see the fan-shaped plantar fascia on the bottom. So you can see where it attaches onto the heel bone. It's very thick in that area. And then as it extends to the toes, it thins and broadens. If loads on the fascia are excessive, the fascia will develop tiny tears. And typically that will occur where the fascia attaches onto the heel bone. As the tears heal, scar tissue is laid down, and scar tissue has less give than normal tissue. So it's more inclined to tear than to stretch. Francis, do you mind showing the ultrasound picture for us, please?
Yes.
So we end up with a cycle. The more the fascia tears, the more it scars. The more it scars, and the more it tears. So the picture on the left-hand side of your screen, which is labeled right, it's kind of backwards, that shows abnormal fascia. And then the fascia on the other side, where it's thinner, that's normal fascia. So you can see the difference between the two aqua blue letters there. So again, the left-hand screen shows plantar fasciitis, where the fascia is actually thicker than 4 millimeters, which is our maximum width that we want it to be. So one of the reasons that plantar fasciitis is so painful, I'll get you to bring up that other picture of the foot, Francis, if you don't mind. We have a nerve branch. If you can see on that picture, there's a little yellow forked thing at the heel. That is the branch of actually your sciatic nerve. So a little bit of inflammation in that area where the fascia is most likely to heal can cause an abnormal amount of pain. And the reason that it's good to have those nerves there is the fat pad on the heel, which you can kind of see on the bottom left. It has a large nerve supply in order to give our brain information about balance. So the nerves are a good thing in a way, but they're not great when the fascia is bothering you because, again, pain is very disproportionate in that area. So patients who have plantar fasciitis will typically report to us with heel pain, sometimes arch pain, but usually the pain is localized to the heel. And a cardinal sign is when they first weight bear in the morning or after prolonged sitting, it's very, very painful. And weight bearing and impact activities are usually their triggers for their symptoms. So plantar fasciitis is the most common cause of heel pain that we see in outpatient practice. It's estimated that 1 out of 10 people, so 10%, will develop plantar fasciitis in their lifetime. So some of the risk factors, oftentimes these folks are overpronators. Their feet tend to flatten more than they should. About 85-ish% of folks with plantar fasciitis overpronate. There is a higher incidence of plantar fasciitis in the athletic population, with relatively high occurrence levels in young male athletes. Middle-aged females with high BMIs are another group that's at higher risk. It's also more common during pregnancy and in individuals with diabetes. And another interesting thing, 2018 research review stated that there's likely an association between depression, anxiety, stress, catastrophization, and heel pains. There are some psychosocial factors at play there, particularly in chronic cases. So one of the reasons that BMI is important, as we mentioned before, in terms of prevention, is that forces through the fascia during running are estimated to be 1.3 to 2.9 times the body weight. And again, bearing in mind, like I've mentioned on podcasts before, that also would take into account rucking, that type of thing. So extra load through the fascia, it increases exponentially with our weight. So as a physio, during our initial assessment, we need to determine the cause of the heel pain. So like I said before, plantar fasciitis is the most likely cause, but there are others. So arthritic conditions such as gout and rheumatoid arthritis can also be causes of heel pain. We can also see nerve impingements, kind of the equivalent. We've all heard of carpal tunnel syndrome. The equivalent syndrome in the foot is called tarsal tunnel syndrome, and that can create heel pain. There's also a nerve impingement in your lumbar spine or lower back that can cause heel pain. So it's important that we differentiate between those two so we make sure we're not barking up the wrong tree. Fat pad syndrome is also an issue that causes heel pain, as is a stress fracture of your heel or your calcaneus. So when we assess a patient, we do need to look beyond their feet, just to see what their mechanics are like and if there's some reason for this overload. So a common muscle imbalance in the hip, in which the muscles that rotate your thigh bone outwards become weak. As a result, you'll tend to walk or run with a little bit of an inward rotation. That will affect the way that the foot hits the ground and overload the inner part of the heel. So we can treat the foot forever and a day, but if we don't address that underlying problem, we'll probably never be very successful. So while we're on this topic, I did want to bring up a little bit about heel spurs, because they can be something that really cause a lot of stress. People, they have this very bad mental image. I have a heel spur, and they kind of think that it's, a death sentence, not literally, but so heel spurs are usually a result of a problem. They are not the cause of pain. So bone spurs throughout the body, so including heel spurs, they are a result of tension on the area where soft tissue attaches to bone. So how the bone responds to increased tension is by laying down more bone, and then a spur forms. So in the case of a heel spur, when there's increased tension and loading on the region where the fascia attaches onto the bone, if you remember from that cadaver picture, a heel spur will form. So the research shows that actually 32% of people with no heel pain. So if you took someone like myself that has never had a problem in my life, x-rayed my feet, there's a 32% chance that I might have a heel spur. So it's just important to remember 1/3 of people have heel spurs and have no pain. So if your x-ray does show that you have a heel spur, please don't be concerned that you will have heel pain forever. It still can resolve even if the spur remains. So in terms of physio treatment, there's a few things we do. The first thing really with most physio treatment is activity modification, and we also need to correct subpar mechanics, like I talked a little bit about with the hip. Night splinting can be really valuable. We have a picture of that. So like I had said earlier, a cardinal feature of plantar fasciitis is pain with initial weight bearing in the morning or after prolonged rest. And this is a result of the healing process. As the fascia heals during the non-weight bearing period, it shortens. When we step on it, the arch will elongate, particularly in those folks who overpronate, and the fascia will tear again. And again, that feeds into that cycle, that tearing and scarring cycle that I talked about before. So night splints allow the fascia to heal without shrinking. So then when you stomp on it in the morning, it's been pre-stretched. And the research shows that with use for 6 hours per night and with removal immediately upon weight bearing in the morning. So it's important, again, if you're going to use it for 6 hours but sleep for 8, we want it to be the latter 6 hours of the night. There's a 98% recovery rate within 8 weeks. So really excellent results with the splinting. So there's a couple options. High load strength training, particularly eccentric or deceleration loading, has also been shown to be really effective. So Francis, we have a video of that if you don't mind bringing it up, please.
There you
We
go.
can talk about that one first. Okay.
Oh, you
So
want
we're
to
just
talk
going
about
to
that
skip
one?
to
Okay.
let's just do this one. So this is a short foot exercise. So just see what this individual is doing is just activating what we call the intrinsic muscles of the foot, just to make the foot or arch shorter. So you don't want to bend the toes when you do this. You just want to lift that arch. So that can be really effective at activating the muscles that help to support the arch of the foot. And then we have the other video, Francis, if you don't mind putting it up. There we go. So basically in this situation, what this guy is doing is a calf raise, but he has his toes elevated. So that increases the load through the fascia. There's a normal calf raise, really focusing on the lowering component, but the toes are going to be extended. That's what that rolled up towel is doing. So the protocols for this that have had really, really excellent results in the research, one set per day, one set of 10, 5 seconds up, a 3-second pause at the top, and then a 5-second lowering. And we typically increase the load after about 4 weeks. So we'll just get people to use a rucksack or hold dumbbells or what have you, and really good results with this exercise in the research. Another thing that can be really effective for cases that aren't resolving with typical treatment is a shockwave. Extracorporeal shockwave therapy could be really useful. The research has shown a 70% success rate, which is actually better than the results seen with cortisone or with PRP injections. So that's a great, great option. We do not offer it in Wainwright, but Edmonton Garrison has a shockwave machine. You can also, there's some stretching that can be useful. I think we have a picture of that, Francis, if you don't mind.
Yeah.
And I always encourage people, especially folks who can't tolerate the night splints, to stretch before they weight bear. So again, just to put a pre-stretch through the fascia before they step on it and it tears again. Manual therapy was sometimes used as well. So we'll do some hands-on treatment to the ankle joint as well as the heel joint, the subtalar joint. Often soft tissue release techniques of the inside of the calf have also been shown to be quite useful in the research. We also sometimes use dry needling, which I can't say is overly pleasant in the foot, but if we get desperate, it can be quite effective. So we'll dry needle the arch of the foot itself as well as the calf. And as you can imagine, needles in the bottom of your foot aren't the most pleasant, but I guess. I also will use taping, and also in cases with severe overpronation, sometimes we do end up having to go into orthotics. So yeah, that's what we do from a physio perspective.
Excellent. I think Jordan, you had something to say about that.
So I was just on mute there. See, I knew I'd stumble at some point. So yeah, I mean, I imagine, most of our listeners are not dealing with plantar fasciitis right now, or plantar fasciitis right now, but there are probably some that are. So some of those treatment options, are going to work, and that's sort of where they're going to want to focus. Their attention is on treatment options rather than doing anything that's a little bit too active that might, further damage that tissue. But for those of you that maybe are dealing with some of the initial symptoms, or you're looking at preventing PF from happening in the first place, what can we do to sort of improve your running or walking stride, or make changes to your current sort of movement patterns that will help sort of prevent this down the road. So, Francis, can you bring up that picture of that running picture? Yeah. So, I mean, this may be an over-exaggerated sort of picture, but it does focus on those issues that Gian had mentioned that can lead to, some of those factors that can lead to plantar fasciitis. So at number 2 there, you see that internally rotated hip. So whether that means, your external rotators just aren't active, they're not stabilizing around that hip joint, which can lead to area number 3 there, what we call valgus knees. So it's where that knee collapses inwards over or inside of the ankle joint towards the midline of the body, which then can lead to number 4, like Gian said, pronation. Overpronation is one of the major risk factors for PF. So, if you look at sort of, like I said, this is an over-exaggerated sort of view at it, but I can guarantee you can walk through any sort of gym, whether it's someone running on the treadmill, someone doing squats, someone doing deadlifts. You're going to see lots of people with their ankles sort of collapsing, their knees folding in, and a lack of control around the hip joint. And it's definitely a precursor to sort of, to plantar fasciitis. So with that being said, Francis, what are your thoughts on some of this stuff? Any sort of tips or tricks or exercises you can give to some of the listeners of maybe, how can they correct, if they're looking at themselves right now in this picture, how can they correct some of these issues that they're seeing?
Yeah, for sure. There is some tips and stuff that we can do to fix that valgus situation. The first thing that we need to know, as Gian already mentioned, we need to find the cause of the injury, or actually the cause of the valgus posture also. So when we did found the cause, it might be created from an activity, a sports activity or something else, not only by just running, but when we found that, we're going to try to do some modification, activity modification, and try to prevent or fix that problem by doing this at first. Now, in this case, it's a running exercise that the person is increasing a valgus situation. And the first thing I will do with that person is work on his biomechanic while he's running. So the form of a running. Some running drills are really essential to improve the running pattern. So the first thing I can show you is a couple videos. They're supposed to be here. There you go. So right here, these are two videos that are really interesting to watch. They're demonstrating what is a skip A and what is a skip B. Skip A and B are, sorry, somebody's calling me at the same time. Skip A and skip B are drills that you can do in the warm-up. Also, it can be done during like a track and field exercise. Now, you guys need to remember that running is an Olympic discipline. That means it's a very complex sport. It takes time. There's a lot to know into that. It's just not walking fast as you can for the longest period of time. So you need to practice your drills. You need to practice your skills on running. Now, in that picture video, you will see these two people doing the skip A drills. Now, the skip A is basically doing a high knee while skipping. All right, now it stopped lagging, so we're good. So you can see these two people. Like the young girl is doing it without shoes, and the man is doing it with shoes. So that's an option. And you can see also the skip B. Now that's the first drill. That's not the skip B, but that's the progress to go from the skip B drill. I'll show you how the skip B is working on the second video. So you will see that person doing the skip B. So you're still skipping, but you're doing that kind of a tap. You're tapping your foot on the ground. So these drills are going to help you on your running mechanic, how you run and how fast you're going to run. Actually, if you do improve your running skills like this, like your running biomechanic, you will spend less energy also. That's another like pros on running in a proper way. You're gonna run faster with less energy spent and with a better speed and a better endurance. So that's why we need to work on these. But every time you do that, you can do that during a warm-up. When you do your running warm-up, these running warm-up, the PSP staff, we are always doing a proper warm-up for you guys. It's always going to be related to the activity that you do. But at the beginning, you're always going to do some high knees, some butt kick, some toe walk, some hill walk. And then you're going to do your skip A and skip B. And after a while, we're going to do some sprints, or actually it's going to be jogging to sprints. We're going to increase the speed into your running drills, and then at the end you're going to do a couple sprints, and then you're going to be ready to do your running exercise or anything else. So these are the tips I'm going to do, or I'm going to recommend. Now we only have 10 minutes left, so I'm going to go faster on the other exercise that I'm going to explain. The first one here, that is with rubber loop band that you can use at the gym. You just put this around your feet, and then you're gonna do some high heel. You're gonna raise your knee up, and then while you're doing this, you want to focus on your form. So you want to make sure that your knee is well aligned when you're going to do this exercise. So that's another exercise that you can do, and my favorite one, because if you are in Wainwright, you know that I'm always prescribing this exercise right here. This is 2 rubber loop bands that you're gonna do. You're gonna put one above your knee, one at your ankle level, and then you're gonna move sideways, front, and backwards. And you're gonna keep that basic position, which is triple flexion, and your neutral spine, and you're just gonna be ready to walk. So that's gonna reinforce all the muscles in the quads and help you to have a better posture when you're doing this, the running itself. So it's reinforcing the muscles in the lower limb and in your pelvic region by doing these exercises. Now, Jordan, do you have any other tips that you can give us?
Yeah, sure. So, I mean, I want to, first off, I want to say that like the approach is going to be different for everyone. It's going to depend on everyone's current injuries that they're dealing with, any sort of previous injuries that they're dealing with, their current fitness levels, how long they've been running for, if they've foam rolled before. So not everyone's going to have the same approach that I take or that, I would prescribe across the board. Like I said at the start of the podcast years ago, I dealt with some discomfort in my plantar fascia, and I had constant, cracking and clicking within my ankle, and I dealt with some really bad shin splints. I was able to sort of do my own research and look into some corrective techniques and things that would benefit me at the time with my fitness level. So basically some basic stuff that really worked for me, to not only, correct, my mechanics, but also to prevent any injuries from happening in the future. First one was the lacrosse ball on the bottom of the foot. Take that, throw the lacrosse ball down, massage the bottom of the foot, the plantar fascia and the different musculature, that's actually interacting with the ground. Now, obviously different if you're dealing with current damage to that sort of area of the foot. You don't want to go and beat that up. But if you, have relatively healthy, tissue, it's okay to lightly massage it and sort of, loosen it up a little bit. Foam rolling the lower part of the leg. So, gastroc and soleus and that sort of thing, and foam rolling from the knee all the way down to your Achilles tendon and loosening up and making sure that it's not constantly tight. I found that was a reason I got the shin splints. Was my calves were constantly tight, and it was a big problem. I work on some ankle mobility drills on a daily basis. I know it helps with squatting and lunging and that sort of thing, but also your ankle joint should be able to articulate. You should have some mobility there to help you, get into a squat position and have that toe plantar flex and dorsiflex with an appropriate range of motion. I personally, I've made a bit of a switch in my footwear. I use a minimalist shoe, not just in my, my training shoes, but in my casual shoes as well. I buy shoes that allow my toes to kind of like splay out and don't like cram them in like I see it's difficult sometimes. I see some of Jenna's shoes and her high heel shoes and stuff, and it's just cramming the toes and the end of the shoe, and it looks super uncomfortable. So I've made a switch there. Obviously the same sort of strategies won't work for everyone, and I'm not encouraging everyone to go out and do the same sort of thing that I did, the same measures that I took. I don't want to sound I don't want to sound like a cliche or make like a silly comparison here or anything like that, but I think that if you think of the feet, as the foundation to your body, similar to a house, if your foundation is all, broken and falling apart and messed up, it's just going to lead to problems down the road, right? Like, if your feet aren't articulating with the ground and it's not providing the proper feedback, you're going to run into all sorts of issues, including plantar fasciitis, if your foot's and the tissue surrounding it isn't articulating it. So, like you said at the start of the episode, Francis, the foot is an extremely complicated, area of the body with lots of moving parts, lots of muscles, lots of joints. It's very important to make sure that they're working properly. I think it's, very underlooked and underappreciated in the world of fitness. I don't think people take enough time to consider the foot when they're working through their exercise programming. So, I just encourage everyone to be a bit more conscious of it when they're training and treat it like you would any other part of the body, and don't forget about it. And hopefully you can prevent some of the issues like plantar fasciitis.
Yeah, that's awesome. Now, if you we're running a little bit low on time, but if you guys do have any questions, feel free to send it to us. We'll be more than happy to answer it. Answer all your questions. You can send it to Jordan, you can send it to Gian, or even me, and we will answer your questions. Now, we do have a special guest that I'm going to admit as right now. She was on the podcast last week, but there's a special event coming up tonight. So, Amber, what is happening tonight?
How's it going?
We're all good.
Good.
Good. Yeah, so I think Francis said, I caught in on the end of that, we have our trivia night tonight. So if you haven't registered, make sure you register quickly because it's going to close by 4:30. I have the link to register in the comments. It's going to be sports trivia tonight. It's going to be a ton of fun. We're going to range from all variety of sports, whether you know sports knowledge or not. It'll still be a lot of fun. There'll be a few questions in there that you'll get for sure. I hope so.
How many people do you have right now registered?
We're sitting at about 30 right now, so
Oh, nice. That's
it'll be pretty good.
Oh
Yeah.
la
that's a
la.
good group.
Yeah, and
Yeah.
there's a chance to win a $50 gift card, right, from Canadian Tire. So
Ooh.
Oh.
exciting times. Who doesn't
Oil
want
change.
another, like a rake, or a baking pan?
Can PSP staff win?
No.
Maybe I'll participate still though.
Yeah, and you would have to know all the answers. So
That's true. I probably don't.
Yeah, I'll be at the top and looking you guys below me. Yeah, don't worry about that. We'll see.
Yeah, I tested it with my husband, and he's a sports guy. He didn't do that great. So
In 1 minute, do you know like your next week sports challenge or something that you can give us on that?
yeah, so on Tuesday I'll be releasing my next sports challenge. I'm going to be attempting one of the ones that Esquimalt has done in the past. So if you want to see what it potentially could be, you can go to their Instagram page and check out the trick shots they've done so far. And I'm pretty confident it will be amusing again as well, because clearly I'm not good at these trick shots, but it'll be fun. And my daughter will chirp me again.
Oh, God.
Yeah.
All right. So thanks, everybody, for all that knowledge, everything that we've learned today. See you tonight on the Trivia Sports event. And I want to see some videos of you trying to do the challenge of Amber. And I'll do the same on my side. I never cheat. Everything I do is without cheating. I'm alone here, so nobody can really testify, but whatever. So try to beat me too. All right, next week we still don't have the topics for next week, but we will. We're still working on a special guest, but me and Gian will see you next week with an amazing podcast on health and reconditioning. So until then, see you guys then.
Yeah.
Ciao.
All right, thanks.